Next up, Bill Snyder.
My choices here. Hi, everyone. Before I start, I want to thank all of the sponsoring organizations for inviting PATH down on the behalf of PATH. And on the behalf of me, I want to thank some people who kept me out of trouble during the time that I was getting ready, because as they learned, I am the physical embodiment of the absent-minded professor. It's very hard to get me to do anything on time. So Nadia and Katie and Danielle, who arranged the air flights, and Katie and Stacy, who are manning the PATH table, I want to extend my thanks to them, and also to all of the panelists, because I thought this was a fascinating morning. Particularly Stephen, I'm actually distracted by what you presented, because I need to talk about what I do, but I'm really thinking a lot about what you do right now. So, because I think it could be very important. Okay, so that works. Now, PATH is a little bit different than the other organizations that have been here. We're a global health, non-profit, non-governmental organization. And so we represent, I suppose, the nonprofit seat on this particular panel. And in order to explain why we're here, because honestly, when we got the request, it was passed all around, you know, who should go to talk about this confluence of commerce and sustainability and social justice and peace. It made a lot of people who were asked to go nervous. And I just wasn't nervous, because I really wanted to talk about it. So I'm going to talk about what PATH does. I'm going to talk about one particular part of PATH, the Technology Solutions Group, talk a little bit about our product development strategy and approach, and then where I think the actual interface with this conference is how we approach public-private partnerships. Because one of the things that makes PATH different is we don't have any products. There are no PATH products. Everything that finds its way into a consumer's hands or a health care workers' hands comes through someone else. We just help them make it happen. So, this is our vision. What we would like to see is a world where innovation ensures that health is within the reach of everyone. The key words here are health. If everything that we do touches in some way on global health, and most of the time there's a reach issue that we're trying to solve, providing technology to an area that doesn't have the benefit of it right now, absent our efforts. There's a three-pillar system at PATH. Any PATH presentation, you're always going to hear about advancing technologies, strengthening systems, and encouraging healthy behaviors, because technology alone doesn't really solve most of these problems. There are behavior change issues you need to address. And typically, in the developing world, which is where we focus, you have systems that don't have the same capacity as the healthcare systems in the United States or most developing countries. I'm going to be focusing mainly on advancing technologies. So, at PATH, we have divided ourselves into groups. Every other group but the technology group addresses all three of the pillars. So, for example, we have a maternal and child health and nutrition group. If it involves any of these things, they're involved in some way. We have a reproductive health group that focuses primarily on women's reproductive health. We have a technology solutions group, always involving technology there. And then we have an emerging epidemic diseases group and a vaccine and immunization group. I do most of my work in the technology solutions group, so the examples that I talk about today are going to be in that area. Now, within the technology solutions group, we have folks that focus on vaccine and pharmaceuticals, stability, drug delivery, injection. We have a diagnostics team, we have a reproductive health team, maternal and neonatal health team, communities and systems, that's your system strengthening part. And then we have this new team, and this is actually how I came to be associated with PATH, that focuses on safe water and sanitation. And I could not agree more with you, Stephen, that the way that we currently manage sanitation in the developed world is not very smart. I think that's what you said. I agree. So we have a fairly structured approach to trying to go from an unmet need to a outcome that is beneficial from a health standpoint. We think of it in phases. There's the innovation phase, that's the product development phase, that's what I'm going to talk about mostly today. But then you have to validate what you're doing. I think we were talking about convincing the Clinton Global Health Initiative that they should look into this form of disaster relief housing. You have to be able to show the metrics. You have to be able to show the proof that what you're offering is going to be meaningful in terms of the metric that they care about. And then there's this notion of integrating this solution into commerce, and that's what I spend most of my time on, working with the private sector to put together a business model that works for them, works for Path, and results in product going out into the world and having the effect that we're looking for. So when we think about product development, we start with a needs assessment, and it always begins with an unmet public health need. There's something that's not happening in the developing world. It may be happening in the developed world, but it's not happening in the developing world, that needs to be addressed. There's a gap. That's where we start. But then we fairly quickly pivot to look at the end user. All of our design and development is always focused on the end user. What are their needs? What do we need to do to get them to either change their behavior or use this or use it correctly or use it every day, right? So everything we do from a development standpoint focuses on the end user. And then when it comes to the metric, we have to be able to show that if people do what we want them to do with this technology, it will have a positive health outcome. Now, this is an example I pulled from a number of different presentations where that case that you need to make is not very hard. This has to do with the use of protease inhibitors as a preventative mechanism for HIV, right? And you can see, if you look at the graph here, that as the use of these inhibitors has gone up, the incidence of deaths related to HIV has gone down. Very direct correlation. You really don't have to spend a lot of time on it. If somebody sees this and they're in the position to invest in this, they're going to say, great, where do I sign? Right? Most of what I work on is not that easy, because most of what I work on has a more attenuated health benefit as a result of something a little more indirect than this. So when we look at developing products, there's basically two buckets that these products fall into. If there's a suitable solution out there, if there's something that works, and the real problem is that it's just not available in the developing world, then that's one set of problems. That's supply chain, that's delivery. That can be super important. But since this conference is sort of about product development, I'm going to focus on product development. And that's what happens where there's nothing available right now that meets this particular need. So there's a need to develop new technologies or adapt technologies. And I'll give you examples of each. This is an example of a space where there was no technology available to meet the need. The need was defined by the fact that in order to deliver certain vaccines, it requires a lot of training. You have to train healthcare workers. How much is the dose? How do you correctly use the syringe? How do you correctly administer it? And then after that, if you think about the fact that we're always working in a resource-constrained environment, there's a predisposition that usually is a good thing to reuse what you can, right? Not such a good predisposition if what you're talking about is a syringe, for reasons that we all know. That's a major form of transmittal of certain diseases, right? So you can't encourage that kind of behavior. In fact, you have to go out of your way to avoid it through design. So what do we got? We've got this combination of making it easier to use, not requiring a lot of training. It would be great if it doesn't have to take up a lot of space. You don't want to have them to figure out the dose. And after you use it, you want it to be virtually impossible to reuse. And we just looked around and we couldn't find anything that did all those things. And that led to the invention of the Uniject pre-filled syringe. And if you look at it, it looks pretty simple. I always thought it was inspired a little bit by bubble wrap, but basically you have a predefined, pre-filled amount of the vaccine that you want to deliver. The way that you deliver it is simply by putting the needle into the arm, squeezing the bubble until it's empty, and then at the end, when you release that bubble, it disables the syringe, so the needle no longer will work with that syringe, and of course it would be very difficult to actually fill that little bubble, so it's not worth the effort to try and reuse it. We capped that off with a little cap that you put on the end of the needle, so that you can throw it away and not have to deal with sharps risk. And you've got something that now can be packed many to a very small box, shipped around the world, and delivered by people with very little training, with very little risk of needle stick injury or disease transmittal. That's what we do if there's nothing out there that we can use. I actually like this story a lot better. Now this is a story about a technology that was out there being used in commerce for a completely unrelated purpose that somebody at Path recognized as essentially being a solution for a Path problem. What it started out as is a label technology. There's a company in New Jersey, that they're the ones that own that heat marker trademark, and they developed a labeling technology for fresh chicken so that a meat manager could look very quickly at a package of fresh chicken and decide if this chicken was going to have the desirable effect when you ate it, right? And what you know is that if chicken gets outside, fresh chicken, outside of a certain temperature range for a certain period of time, it's not going to have the desired effect when you eat it. So meat manager's looking at the chicken, pulls one up. If the label has an indicator on it that it's left this temperature range for a certain period of time, you throw it out, right? So the PATH staff person saw that and thought, wow, this is basically the same problem we have in the cold chain for vaccines. We've got exactly the same problem. If a vaccine goes outside of this temperature range for a certain period of time, it's not going to be effective, right? Now, the problem was the temperature range is not the same as chicken, and the period of time is not the same as chicken. So they contacted this New Jersey company, and they said, well, can you tune this? Can you tune this ink so that if we give you a temperature range, we give you a period of time that this ink will react to those parameters? And the New Jersey company said, well, we think so. We had to do it for chicken, right? I mean, we didn't stumble our way into this. And that was essentially how this new technology was developed. Now, what it does for us now, you can see that there's three things here. There are two different size vaccine vials, and then there's a preloaded syringe with vaccine in it. And this technology allows you very quickly to look at the label and know whether or not this vaccine has been outside the parameters from a temperature standpoint for a certain period of time. Right away, you know if this is going to be effective or not effective, right? So now we've got a solution, right? But let's think back to what I mentioned in terms of being able to prove it and then being able to make it meaningful. The technology alone was not that hard to do. The hard part was convincing UNICEF. UNICEF funds and delivers the vast majority of charitably originated vaccines around the world. An awful lot of the vaccines that go to the developing world come through UNICEF. And so what we had to do is we had to show them, look, how much do you think you waste? And of course the answer was, we have no idea, right? Because what they were doing at the time was they were asking questions. How did it get from the train to the truck? And how did it get from the boat to the train? And then how did it get here off the truck? Bicycle? And if there was any chance at all that this vaccine had been outside the temperature range for a certain period of time, they had to throw it out. They were throwing out a lot of vaccines. So what we were able to do is show, look, every time there's a handoff, just pull a sample and look at the label and determine whether or not it's been outside the cold chain range. And it did two things. One, it gave them a much more confidence about whether or not vaccine could be used or if it should be thrown away. And the other thing was it helped them isolate the failure point. The failure point was almost always in the last mile when it's on the bike, on the back of a bicycle or some other small vehicle. And that allowed them to implement little styrofoam containers that would prevent that. And UNICEF very quickly said, well, not very quickly, but they did say ultimately, yes, we want this to be part of every vaccine that we fund. And the result now is that over 4 billion labels with this ink technology on it have been distributed on vaccines around the world. Okay, so now solving the technology solution is one thing, but as the UNICEF example illustrates, what you really need to do to be effective in what we do is you have to be able to understand who the stakeholders are, right, what they consider to be important, and then a really important stakeholder, and I think the reason I'm at this conference talking, is the private sector partner that works with PATH to commercialize the technology that we help them develop. Without that private sector partner, none of these things would ever find their way to the market. When we looked at the Uniject, Bendon Dickinson, which is a huge medical supply company, they license the technology from us. They're the ones who make it available around the world. In the case of the heat marker, it's this company out of New Jersey, and I wish I could remember their name, but they're on our website. So we have to think about this sort of three-way stakeholder puzzle. We've got private industry, we have to have business models that work for them. We've got the global health community, we have to be able to show that what we're doing is important and they should invest in it. And then governments, typically, in almost everything we do, there's a regulatory aspect. Most of the things that we work on have to clear some sort of regulatory hurdle. Okay, so when it comes to partnering with the private sector, I'm going to very briefly tell you where I came from, because I came from the private sector. I'm a lawyer by training. Sorry. And I spent almost all of my professional career at Microsoft doing business development in emerging segments during a very interesting time at Microsoft, where they kept going into new segments, new segments, new segments. And my job, wow, was to figure out I have 2 minutes left. My job was to figure out how to enter those segments. So what I'm doing here at Path is essentially exactly what I used to do at Microsoft. We're just talking about different segments, and we're talking about different types of partners. Here's what I found is the key to working well with the private sector. You have to start with alignment on objectives. You'd be surprised how frequently, when something fails and you do the post-mortem, it failed because the organizations did not have alignment on objectives. They weren't actually trying to accomplish the same thing. They were working together for different reasons, and it collapses right under its own weight. The other thing is to distribute responsibilities based on their core competencies. You can't expect certain things from the private sector. There's no reason why you should, and yet it's become popular to expect the private sector to do everything. And then finally, allocation of incentives. It's got a pencil. You've got to have a business model that the private sector wants to continue to pursue. That's what makes it sustainable. I'm going to move quickly now because I know I don't have much time. So this represents our general theory of investment. If we were dependent on the private sector feeling that the very best way to invest their marginal dollar was to provide access to the developing world for their particular product, we'd be waiting a very long time because you're never in the developing world going to be the best marginal investment for the dollar. So what we do is we try and reduce their risk and make it a better investment by helping them understand what they need to do with their products to make them successful, and also we help them understand the market landscape in the developing world so they feel that they can build a business on this without having to figure out how to build a business on it. And this is when I mentioned that you can't really expect the private sector to do everything. This is our model. It's relatively new. But it's this spectrum approach where we think about what can we expect from the private sector and what can we expect from the public sector. We've come to find that from the private sector you can expect innovation, very, very rapid response to stimulus, right? If they feel like they understand what's going on, they're right there, moving fast with something new that they think is going to work. But you really can't expect the private sector to be thinking about fair distribution of their goods, right? We want to distribute our goods based on who needs them most. That's not a private sector function. If anything, it's a governmental function, right? So what we try to do is we try and put together partnerships, product developed partnerships, where there's somebody whose job it is to figure out who needs this most and how can we get that to them, and then the private sector does their part to make it very, innovative, appropriate, and usable. And that seems to work pretty well. I'm going to actually jump through here because I think I've already gone through my 2 minutes and I don't want to go too long. Okay, let's back up. All right, so we do a lot of different things. If any of the things on the table that Katie and Stacy talk about are interesting, or if anything that I've said today is interesting, we have a great publication section on the PATH website. You can click there and you can find a lot more information. Thanks a lot.